Peutz-Jeghers syndrome is a rare, even very rare tumor risk syndrome, characterized by certain key features or characteristics, and in particular the association of gastrointestinal polyps, the mucocutaneous hyperpigmentation, in particular around the mouth. They are just a diagnostic sign, they are benign, there's no risk for anything. But the polyps, they can cause trouble even in early adulthood and in teenager age, because they can lead to obstruction. Then you can have a so-called intussuspection, so a bowel obstruction. It's an emergency situation. Or these polyps can cause bleeding with anemia. So that are important complications and symptoms at early stages of life. And in later stages, then you have the cancer risks, and it depends on the cancer. The highest risk probably is really colorectal cancer and gastric cancer. All these cancer risks are describe patients without any treatment, without any surveillance usually. Then you have maybe a 40% lifetime risk for colorectal cancer, maybe 30% for gastric cancer. For the small bowel, it's lower. It's maybe just 10 or 15%. And pancreatic cancer is a big issue in Peutz-Jeghers syndrome, one of the highest risks, depending on the studies, between maybe 10 and 30%. That's very high compared to the general population. And females have some gynecological cancers, so some kind of ovarian cancers. And then we have also another cancer in women, that's the so-called adenoma malignum of the cervix. It's also very specific tumor, some kind of adenocarcinoma of the cervix. Breast cancer, of course, is another one in females, which, depending on the study, 30 to 50%. That's more or less the same order of magnitude with other inherited types of breast cancer. So the very common hereditary breast and ovarian cancer, which we have similar risks, even a bit higher. So that's really a high risk situation. I think that's the most important cancers. So the most important clinical features are really this hyperpigmentation, this dark brown or dark blue spots. It's hypermelanotic spots, typically around the mouth or at the buccal mucosa, sometimes also around the eyes or the nostrils, and in particular also at the fingers or even the perianal area. But of course, most visible are those in the face, and these are recognized, I think, by most doctors, because there are not so many differential diagnoses if you have this characteristic hyperpigmentation. And it's in particular important to recognize this when it's a de novo mutation, you have no other affected family member. So at this time, no one knows that the patient may have a Peutz-Jeghers syndrome, and to diagnose it at an early stage, this typical hyperpigmentation has to be recognized. The tricky thing is that these hyperpigmentation can fade in puberty or adulthood. So when you see the patients in their teens or 20s or later, this might not be visible anymore. So it's important to ask the patients or the parents of the patients if they have recognized those symptoms in early days. And they're not present at birth, but usually they occur during the first years of life. So that's very important. And later on, of course, in early childhood, then the polyps can make trouble. And what you need for a suspicion of having a Peutz-Jeghers syndrome is a combination of these hyperpigmented areas and at least one Peutz-Jeghers polyp, so histological confirmed Peutz-Jeghers polyp, or if you have no pigmentation, then at least two Peutz-Jeghers polyps. Or a combination. When you have a positive family history and you have already diagnosed the patient, then you need just a bit hyperpigmentation and just one polyp to make the clinical diagnosis. So the diagnosis is not always easy, because sometimes patients do not have these typical hyperpigmentation macules. They have just polyps and they're not seen, they have no symptoms. So, but if you have at least one of these typical features, that's a reason to recommend genetic testing. In particular, in those cases where not all the typical symptoms are present, you cannot really make the clinical diagnosis. So you need the confirmation by finding a genetic mutation in the gene. The STK11 gene is a typical tumor suppressor gene located on chromosome 19, and today we know only just this gene as a causative gene for Peutz-Jeghers syndrome, so probably there are no more other genes involved. So we just have to screen this one particular gene. And in routine genetic diagnostics, we take a blood sample and we extract the DNA out of this blood, and then we screen this gene and look for these germline variants. And if we have identified a germline variant, we can make the genetic diagnosis, or we can confirm the clinical suspicion. And if this is done, there is a lot of advantages for the family, because once we have identified the reasons, the diagnosis is clear, we have a clue regarding the prognosis, we can recommend the surveillance examinations, and in particular, we can test all the other relatives of the family, the persons at risk. Most of them are asymptomatic at young age, and if we can offer this predictive testing for this genetic variant, and those who carry this mutation, they have the risk of getting these tumors from Peutz-Jeghers syndrome, and we would offer them certain surveillance measures. And when we can exclude this particular mutation in family members, then they do not have any risks anymore, and they don't have to worry about the syndrome anymore. They don't have to do the more intense surveillance measures, and it's also a psychological relief, of course. And so that's one of the most important issues, to do genetic diagnostics and to find a mutation.